Everyone, hello. Welcome to this session. My name is Doogie Marks, for those of you who don't remember. We are going to be talking today about communication skills. We're going to be looking at a little bit more advanced stuff than we've spoke about in the past. You might remember in first and second year we spoke about some of the basic communication skills, and you've obviously had your communication um, skills day as well with the actors in second year. Today, we're going to build on some of those skills. I'm going to talk a little bit more in depth and in detail about these types of things. There are obviously some ILOs. Communication's obviously done in various ways. You've got spoken communication, you've also got written and electronic. We're going to be looking a little bit into that and how you can communicate effectively. We're going to be speaking about some of the more, as I've said, some of the more advanced communication skills. We're going to be looking at things like talking uh, with patients in issues that are sensitive, things like raising concerns, talking about patient diagnosis, and we're going to be looking at how to sort of minimize distress in those situations, as well as communicating with patients. Obviously, the other big group of people who you will be communicating with as a dentist are other healthcare professionals. We're going to talk about how you can communicate effectively with them as well, how you can liaise in ways that are best for patient care and patient outcome. Okay, so by way of introduction, I'm going to refresh your memory a little bit on communication. We've spoke about its importance in the past. We spoke about trying to help patients change their behaviour. Uh, you've obviously tackled OSCE stations where you had to communicate with patients, and you've seen that not just in the station that's focused on communication, but on the other stations as well, uh, communication is really important and is one of the main skills that you're actually using. You've obviously worked with simulated patients as well. Now, what I'd like you to think about is to moving forward, what do you think the biggest challenges might be regarding communication in the next couple of years as you're finishing off your training? If you want to pause the video at the moment and see if you can jot down some thoughts and see if it's the kind of things that we're going to be talking about today. If you can't think of anything, that's okay. But you may have had some thoughts, some worries, some concerns whenever you've been doing the OSCEs, whenever you've been practicing up to now, and you've maybe thought, oh, I don't know how to do that, or wonder how um, that particular conversation would go with somebody. Pause the video for a minute and have a little think and jot down a couple of points. And hopefully we're going to cover those today. If there's things by the end of this session that you're still not sure about, feel free to drop me an email. That's fine. We can discuss. Okay, so communication is really, really important. Uh, Building trust with patients, building that relationship with patients is one of the main bedrocks for good patient outcome. The more a patient feels they're comfortable with you, the more a patient feels like they can trust you, the more relaxed they'll be, and because of that, the better their actual health outcomes will be. It also makes a difference for adherence as well. If we're trying to get patients to think about their health behaviors, their brushing their teeth, their sugar intake, it actually makes a difference how these messages are communicated to them. Just telling somebody to brush their teeth twice a day doesn't really work, doesn't really make a difference when it comes to actual health and health behaviors. There's ways as we've spoke about, there's ways to work with them to help them to think about um, how they should actually look after their teeth. Oh, excuse me. Obviously, communication matters because we need to make sure that we're recording things accurately. That's usually important when it comes to patient safety and patient care. Making sure that notes are taken clearly and correctly, making sure that Written communications to other healthcare professionals are done clearly, making sure that conversations that we have with other healthcare professionals are also clear. All these are massively important. Um, it's important for the safety of care, but it's also important because it actually reduces complaints and conflict. Better communication heads off future problems when it comes to communication. Communicating difficult things well reduces the amount of distress and helps patients and staff as well to actually get along well and to find the interactions with each other um, meaningful and helpful. And also within teams, we want well-being and psychological safety to be at the core of working with teams. I'm sure you've found this in jobs that you've done yourself already, but you'll find that you can really cope with a lot in a job so long as the team that you're working with communicate well and work well with each other. And by work well with each other, what we really mean is communicate well. Um, you can put up with a lot of difficulty in a job if you feel as if you've got trust, you've got safety when it comes to the team. And a lot of people end up leaving jobs of all kinds, of all descriptions, because they feel as if there's been a breakdown in the communication with their with their team members, be it people senior to them, be it people the same level, be it people who are junior members of staff. And so because of that, it's massively important to make sure that we can get these skills incorporated into how you work really early on in your career. So when it comes to actual communication in terms of dental care, there are essentially 10 key elements that are important, 10 key areas where communication is happening on a daily basis regularly. I'm going to give you a rundown of them, and you'll be aware of what these are already. Um, History taking, obviously making sure that there's nothing that's missed, making sure that there's nothing that is important in the history that isn't taken into consideration. You might think that the onus for good history taking is on the patient. It's actually not. The onus for good history taking is on the clinician. Um, the patient doesn't necessarily know what's relevant to their medical history, but making sure that you, as a clinician, can ask the right questions in order to get the right information is hugely important. Explaining test results is another skill that happens regularly. There are words that you use as a dentist that don't really mean anything to patients, to the general public. Words like occlusion, words like caries, these are words that aren't really clear in general parlance and general use. Making sure that you're able to translate those words into words that the patient understands without necessarily patronizing the patient as well. Um, Explaining diagnosis and prognosis, explain to a patient what has been discovered and what that means for them long term. That's really important when it comes to communication, making sure that they understand clearly, making sure that you're clear in how you describe these pieces of information, and also you know when to discuss them. Planning treatment and interventions and discussing treatment options. The planning treatment is important when it comes to communication with potentially other clients, other clinicians, um, and making sure that in that you're including the patient and you're discussing treatment options with the patient clearly and in ways that they have the correct information to inform their decisions so they can move forward. Gaining informed consent is another huge key area. Different individuals have different levels of ability to consent, depending on things like age and cognitive ability, and relationship dynamic with yourself as the dentist and with other people as well. It's not quite as simple as just getting somebody to sign a form. Making sure that the patient has the information in the above categories and then is able to clearly and openly and honestly communicate that with you, and then to understand what that means for their future treatment, and then to give consent. Motivating behavior change. We spoke about this in depth and in detail. Um, Again, just telling people what information they need about teeth brushing or about sugar intake isn't enough. You'll know yourself how often you eat 5 bits of fruit and veg a day, despite the fact that you heard that message many, many times that this is what you should do. Making sure that patients have the information and also are aware of what a plan might be for them to change behavior is also hugely important. Breaking bad news is also a really important dental communication skill. This is one of the ones where it's very specific to professions like dentistry, like medicine, like nursing, other healthcare professions, where often you're telling people news that can really be life-changing and life-shattering potentially. And there are ways that that process can go well or badly. It can go badly where the patient isn't clear on what the information means. It can go badly where the patient is so upset needlessly by the information. The ways that you communicate this information is hugely important when it comes to making sure that your main patient needs appropriately. Handling complaints, even the best clinicians will potentially at some point come across complaints, not necessarily just about themselves, but about other members of staff. That can be quite an upsetting thing for healthcare professionals. It can be potentially devastating if it's handled uh, incorrectly when it comes to the communication. And also before complaints come in from, or as well as complaints coming in from patients and from other staff, sometimes concerns need to be raised in ways that are not necessarily a full level complaint. So, members of staff, junior members of staff who you're maybe concerned about their practice and they maybe need to just learn more skills. It may be somebody who's more senior than you, who's maybe making decisions that don't comply with guidelines. And it can be about managing distress. It can be about managing the distress of your colleagues or of patients or of yourself as well. So these are the 10 different areas that dentists will be communicating um, in. I want you to have a little think. Again, you can pause the video and look at these. How confident do you feel in each of these 10 areas at the moment? Some of them you might feel as if you're quite good and quite skilled at. Some of them you might think you've seen protocols for how they're done. You've seen frameworks for things like history taking. You might think that they're fairly straightforward. Sometimes indeed they are. You might see some of the others and think, oh, I'm not too sure about that. I'd be a bit worried if I had to deal with that issue. That's okay, because at this point in your career, you wouldn't be expected to necessarily know everything about each of these skills. And in fact, clinicians who are very well experienced um, and are very long in the tooth can still struggle with some of these as well. So we're all lifelong learners in that sense. Some of these issues are pretty complicated, and making sure that you've got the skills in them. We can't really cover it all in a couple of classes, but we can certainly give you the basis if we're going on into the future and building your skills when it comes to things like handling complaints, breaking bad news, managing distress. And there are definitely pitfalls, and there are do's and don'ts. There are things that can help you as well to make sure that you're good at these skills and you can learn. Confidence will build with experience as well. The more you practice, the more you get used to it, the more placements you're on, the more you remember important skills and the important lessons, the better you'll be. I think also making sure that as you go, you reflect as well. We're all about being reflective practitioners, and we're all about making sure that we um, are constantly reflecting upon what went well, what went badly. Having that reflective um, process as a regular part of your practice is really important. Making sure that you're willing to admit where you've made mistakes, making sure you're willing to say that if something went badly or something didn't go as well as it could, making sure that you're able to stand up and say, okay, maybe X, Y, or Z person didn't communicate well, maybe maybe systems aren't correct, and those type of areas are where often we're likely to place the blame, but also able to say, right, are there things that I need to change in? Are there ways of communication that could be better from the perspective of what I do? How I could make my communication better. And that's okay. That's called learning. It's okay to learn. Okay, so one of the big ones that students can look at on that list and feel quite daunted by is the area of breaking bad news. Excuse me. Apologies. So breaking bad news is a key point, a key part of all dental work. What is bad news? Um, there are some areas where you'll be breaking bad news regularly to people. Often involves things like unexpected tooth loss. Um, it can be that dentists are extracting teeth all the time, and to them it's not really something that is a big deal, and they just see it every day, and it can feel like it's just a routine part of dental care. But you have to remember that things that are regular for you as the clinician are not necessarily regular for the patient. Um, it may be that you've extracted many teeth in one day or in one week, and this is just the next one, and you have to just extract this tooth, and you might just find a clinician saying to a patient, "Oh, so that tooth has to come out," and then just moving on. That can actually be quite a big deal for a patient. Um, Often, one of the first things to do whenever you're thinking about communication is to try to put yourself in the position of the other person. Try to imagine what it's like to be that person in that situation. Now, for some people, that's quite easy. For some people, that's quite difficult to do that. Um, but if you imagine that if somebody had said to you, well, you have to lose this tooth and you weren't expecting it, think about how that would make you feel. Think about how it would make you, what it would make you think. That's the sort of first step. Now, it may be that you're somebody who wouldn't be particularly bothered about losing a tooth. Maybe, you just think it's not really that important, so you wouldn't really bother. That's that's okay for you. Um, the second step is for you to imagine not just what it would be like for you to be in that person's shoes, but for what it's like to be them in their shoes. There may be differences between you and them in terms of personality, in terms of their makeup, their psychological makeup. And one of the skills can be to imagine yourself as them in that situation. So not imagining yourself as you, but in that situation, but imagining yourself as if you were them with their particular disposition, and then to think, well, how would that make them feel in that situation? That's quite a tricky skill. And again, it's something that some people might find quite easy, some people might not, but it's quite an important first step in any communication area. Try to really think about what would it be like to be that person in that situation. There are things that you would maybe be more uh, intuitively aware of that would be difficult. Things like treatment failure. There's maybe been uh, an extraction that hasn't gone to plan, um, or there's been some other type of negative outcome of treatment that wasn't expected. You might be more aware that that would be bad news for a patient, and you have to think about how you communicate that, how you communicate that to them. Um, 'Cause often you've got issues that are compounding with patients as well, and you've got complex cases where there's more than one problem. It's not even necessarily that there's more than one problem with, say, a tooth, but there's maybe more than one issue that's affecting the patient treatment. It may be that there's a particular problem with their dental care, but you're also aware that this person has other ongoing health issues. Maybe they're a cancer patient, maybe they have ongoing autoimmune diseases, maybe they're in a situation where the complexity is the fact that they're a child and there's a parent involved as well. So it's complex in terms of there's two people really involved, not just one. It may be that there's neurodiversity involved, and the person themselves has a diagnosis of autism, which can also add to the things that you have to think about as a clinician when you are trying to talk to this patient and you're trying to break bad news to them. So these are the kind of places and situations that can affect um, dental care when it comes to breaking bad news. There's some fairly simple principles as well to think about when you're discussing uh, bad news with patients, making sure that the information is understandable. Again, making sure that you don't use the jargon with the patients that you would use when you're writing your notes or you would use when discussing cases with colleagues. That's one of the big things. Tailoring the information, tailoring the way that you say the information to the patient's ability and um, say age as well. Um, Make sure that the information is personalized. Again, the information that you write in your notes is very often not particularly personalized. It's clinical in its language and its expression. That's not the same language that you would normally speak to a patient in. Um, and also making sure that the information is accurate. You want to, first of all, make sure that what you're communicating is 100% correct. An area where complaints would be quite likely to come in would be a situation where information was given inaccurately to the patient. And also making sure that the patient has the complete information as well, making sure that everything that they need to know is there in the package of information that you're giving them. It's some basic starts off with thinking about breaking bad news. Give you some more examples. Bad news is really anything that alters the patient's expectations about their future in a negative way. This is also important when you're thinking about the more cosmetic sides of dentistry that are becoming more and more popular and have become more and more popular in the past, say, 10, 15, 20 years. Um, people's expectations, some people's expectations about their teeth and what their teeth should look like have really changed from what they used to. And you've seen recently some, I'm sure you've seen them, some toothpaste companies trying to kind of counter that with some of their advertising. I can't even remember what company it is, um has a campaign at the moment where they say uh what is it, healthy teeth uh or perfect teeth are just healthy teeth, and they're trying to kind of make sure that young people particularly, I think, aren't um necessarily uh bombarded with the message that teeth need to be straight and need to be white and need to be perfect. And that's good. But you might find that there are particularly some young people and maybe some older people as well who have that expectation, have that expectation for perfect teeth. Maybe that you don't have that expectation. It may be that you have the expectation that um, perfect teeth are just healthy teeth. But it may be that somebody, the patient, has this extra layer of expectations. And it may be that you think, well, it's not bad news to hear that um, they can't get their teeth straightened exactly the way they want it, or um, they can't have their teeth whitened particularly the way they want it until they deal with this underlying uh, more clinical medical reason or medical treatment that needs done. For some patients, that can be bad news. Something you haven't necessarily, or just it's not necessarily thought about. It wasn't even necessarily a problem for dentists, say 20 years ago. Some specifics about these areas. Most adults, to some extent, don't really expect to lose their teeth. Um, Therefore, I would say that almost all tooth loss in adults is unexpected. It can also be a sign for adults that um, they're aging. It can be a sign for them that they have to think about their own future mortality. They have to think about the fact that um, the future maybe for them could or will involve various sicknesses and various illnesses and ultimately their own demise. And losing your teeth as an adult can be a sign of that. And it's something that um, we need to consider whenever we're communicating with patients. Worry and distress, or distress, is about two things. Number one, it's about worrying about the future, and number two, it's about ruminating about the past. So tooth loss in adults can, like I say, indicate a future that will ultimately end in your own mortality. But it can also be about ruminating about the past. So the distress that can be caused can be a person realizing that maybe they haven't looked after their teeth as well as they could have. They haven't looked after their health as well as they could have. And having that moment where in some ways your health behaviors and your health decisions of the past come home to roost and kind of come to a fruition of difficulties where you have to get this tooth out. That can be quite a heavy weight and a heavy burden on somebody. So all of that can be going on in a patient's thinking whenever you're telling them that they have to get a tooth extracted. So it's quite an important um, thing, and it can be quite upsetting. In children as well, the main difference with children would be that we would expect for their baby teeth to come out, and that seems to be expected and normal, and that's part of the growth process. Whenever children have to have or lose adult teeth, the same issues would apply, but potentially even more so because they haven't necessarily had really any time um, to kind of have that developmental stage sort of going through and to actually have their adult teeth for a while. So that can be quite important to think about that when it comes to children as well. Um, Treatment plans are great and they have to be there, but sometimes treatment plans can change because there's complications that are not expected. That can be whenever you're doing something as simple as putting in a filling. It can be something much more complicated. But treatment plans do shift and they do change because new information comes to light as you're treating this tooth. Making sure that that's communicated to the patient properly. The problem for a patient can be when they're mid procedure and their mouth is open, the dentist and the dental nurse are leaning over them, and then the dentist says something to the nurse that goes, "Oh, uh-oh," or "Oh, that's unexpected," or says a sort of passing line to the patient that lets the patient know in a way that's not great that the treatment is now going to change or have to change. That can be quite distressing for the patient. When disease is more advanced than expected, again, this can relate to the tooth loss. It can be that there's a problem with the tooth um, that is more developed and more advanced than expected, which means that it needs to be removed. Anything that involves that negative change in the outcome in the process, that can be very, very difficult and very, very upsetting for patients. Other parts of bad news as well, financial implications are bigger than expected. Unlike medical care, dentists have to almost always think about the financial aspect for their patients. That can be quite important. That can be quite upsetting for patients whenever they're having to deal with the pain and distress and the difficulty and the psychological difficulty of uh, treatment and of a complex case and a complex presentation. And then all of a sudden to have a financial burden laid upon them that they weren't expecting as well, making sure that that's avoided. Um, as well as the more day-to-day and routine parts of dental care, there's also more long-term, more lasting, and more severe things that are part of dental care. Uh, Different pathologies, things like oral cancer, suspicion of, confirmation of oral cancers. That's obviously very important when it comes to thinking about breaking bad news. How that's communicated is usually important. The way that cancers are communicated to patients has a huge impact upon their well-being, and it's massively important that that's done well and done properly. Also, people don't necessarily think whenever they speak to their dentists that they'll have to think about necessarily referral to secondary care. They might be more inclined to think that way when it comes to their doctor. People know that if they go to their GP, very often the GP is the gatekeeper to other services, and the GP will be um, the road enter to a referral to somebody else. And people, when it comes to medical care, can often see that as being quite a positive thing. When it comes to dentistry, it's not the way that people think as much. So people can think about it in quite a negative way. People can see it as being a sign for concern rather than a sign for investigations going well. So that can be quite an important distinction as well, and something that you don't necessarily think about as a dentist. You might just think, okay, referral to secondary care, that's just what we do, that's just part of the process. But that can be quite upsetting and quite distressing for patients. So making sure that we talk about that in a way that's appropriate with them is huge. Treatment also doesn't always go as well as it could. Sometimes treatment um, fails, or sometimes the prognosis following treatment um, isn't good either. That information isn't really important to be communicated to patients, and it's really important that it's communicated well, and it definitely counts as bad news. Making sure that disclosure of medical contradictions affecting treatment can also be really important. Making sure that that information and the way that that disclosure is handled is very, very important. And unfortunately, clinician errors do happen, or uh, adverse events also happen as well. Uh, that's obviously by nature is very bad news for a patient. And the way that that's handled can be hugely important when it comes to thinking about making sure that patient care is done appropriately. Communicating the need for behavior change, alcohol reduction, smoking cessation, may also often cause distress. Reducing sugar intake as well. Uh, it may be that these are things that people have relied on and ways that people define themselves and the ways that they have really coped with life. So it goes way beyond their health. It goes into their whole way of being and whole way of thinking about themselves as well. Um, and also delivering disappointing aesthetic results or unmet expectations. And again, as expectations get higher and higher uh, for dental outcomes, there's more likely to be disappointment. Um, as those expectations, unfortunately, because of things like social media, might rise to beyond what we would see as being as being reasonable.